I'm Dr. Shelly Singh. I'm Senior Consultant, Obstetrics and Gynecology at Rosewalk Healthcare and Birthright by Rainbow, Delhi. These are troubled times, and I have so many pregnant girls who ask us this question that how am I going to come and meet you? How am I going to manage these antenatal visits? In the same way, you would be having the same question to your obstetricians. Obviously, you cannot be coming to the hospital as used to be in better times. So it's important that at least there are a bare minimum of visits and ultrasound scans which can be done. The first one will be required to be done at around 6 to 7 weeks of pregnancy. Following that, we will need to do a scan at around 11 to 13 weeks of pregnancy, which is your NT-NB scan, and along with that, the dual marker test, which checks for genetic abnormalities in the baby. At the same time, you can meet your doctor and she will change your medicines at the same sitting. Following that, we require one more scan, which is to be done at 18 to 20 weeks of pregnancy, which is a level 2 scan or an anomaly scan, which checks for congenital defects in the baby. That's important. At the same time, meet your doctor. She will see all your investigation reports, and we also can give you the first dose of tetanus toxoid. The next time you actually need to go to the hospital is at around 32 weeks of pregnancy. Some even do it at 30 weeks of pregnancy, where you will get your scan done, which is the growth scan that can be done. At the same sitting, you can show yourself to the doctor, and another thing is that you can even get the Tdap vaccination done at this point of time. At 32 weeks of gestation and beyond, the way to know if the baby is doing fine is with the help of a kick count. So just keep recording your baby's movements. You'll be really happy that the baby is doing fine with these movements. Now, following this, the last scan, as I generally get it done, is at around 36 to 37 weeks, which is the last scan. At the same time, your doctor can also examine you and she will tell you about what are the signs of labor. We don't need to go again to the hospital at all. The only time then you would require to go after that is when you have onset of labor in the form of either labor pains, or if there is leaking, or if there is a bloody discharge which is there. At any point of time, if the baby's movements are less, you can always speak to your doctor, and don't worry. Most of your obstetricians are there with you in these difficult times as well. Most of us are also in direct contact with our patients with the help of even video conferencing, and you can even speak to them over WhatsApp. So don't be scared. This is a time which is definitely difficult, but this too shall pass.